and welcome to the Axiom Medical COVID-19 Vaccine Facts versus Fiction live stream that we're hosting today. Just a quick background. My name is Holly Foxworth, and I am one of the registered nurses. I'm also the marketing manager for content here at Axiom, in case you've stumbled upon our feed or you're new and you're not familiar with who we are. But as always, I do have a brilliant team, the best minds in medicine and communication, both that are going to be joining our panel today. We have Dr. Scott Cherry, who's our Chief Medical Officer. We also have Dr. Peter Matos. We have Chief Marketing Officer, Derek Wheeler, and then also Communications Director, Autumn Brennan. So they're going to walk us through some of those most recent myths that have been floating around, whether that be on TV, on social, etc. All right, so let's see. I'm going to go back to Dr. Cherry and Dr. Matos and talk to us a little bit about herd immunity and why is it that maybe you can kind of explain what herd immunity is and then talk to us about why we may be hearing different things based on the type of media that you're listening to. You know, you may hear on CNN one day that we're at this percentage versus, you know, Fox is the next day and we're saying something else. So what is this and what is it, you know, what's accurate? What can you believe?
Mm-hmm. Well, I can start off a little bit and provide some context. You know, herd immunity is a well-established kind of phenomenon where once a population has a certain level of immunity to an infectious agent, then the small proportion that maybe is not immune through either vaccination or natural infection actually gets a huge benefit of not being susceptible to disease, because essentially you could think of it as a bunch of zebras kind of on an African landscape. And so say a sick or slower running zebra is in the middle of the pack. If there's any predators looking at the pack, it essentially protects them. And so if you take it more to the medical model, those that are immune, you know, say there's 100 people and 80 or 90 of them are immune, that means the 10 that may be interspersed in that crowd won't be exposed to it because they basically have this protective effect of that larger population. You know, and I think there's a lot of discussion about what level of herd immunity will be needed for COVID-19. And the way I understand it, but would want Dr. Matos' opinion, is the way I've seen it is, you know, the level of percentage to make herd immunity is a function of kind of the infectiousness of the infectious disease, or the R naught, so to speak, the reproductive number, which is kind of like, if someone's infected, how many other people could they potentially infect during that life cycle? You know, and I think most diseases fall between like 60 and 80%. But I was just curious if Dr. Matos has had kind of any thoughts about where he's landed from his work on this in infectious disease.
Yeah, I would say, you know, I always say a pandemic is a living, breathing thing. We never know at any one time what the R naught is, which variant do we have, right? Mm-hmm. And which vaccine do I have? So I think rather than focusing on herd immunity, you know you're at herd immunity when you have decreasing cases, decreasing hospitalizations, decreasing positivity rates for COVID tests. And, you know, and then of course, if you have all of those, you're not going to have many deaths or hospitalizations. So I think if you look at what the outcome of herd immunity is, that's almost a better way to think of it, rather than being, you know, set on a particular number. But Dr. Cherry's right. I agree. I think, you know, if you read all the different experts, in that it's in that 60 to 80% range, and things that affect that number going lower would be more effective vaccines. Check, we have that. Things that affect that number being higher towards that 80% would be if we have some type of super variant, like an escape variant or something along those lines, then you're going to have a higher number. So I think it's kind of looking at all of the pieces. It's not like this magical number that it's perfect. Again, a pandemic's a living, breathing thing that's affected by the particular COVID variant. And then how does that variant do against your vaccines? Those are the two main components that'll determine what that number is for herd immunity. And again, herd immunity, you're going to see decreasing cases, hospitalizations, and positivity rate for COVID.
Good information.
That's really helpful because, you know, I think the way I took what you said is it's versus a static approach, it's more of a dynamic approach. And that's been something in my mind because, you know, there's kind of two types of immunity that we've seen in infectious disease, where you have kind of a very comprehensive sterilizing immunity with like polio, diseases like that. And then you have the opposite spectrum with like flu, where you have this amazing genetic drift every year to where you have basically epidemics every year. And so I think COVID kind of falls somewhere in the spectrum there, but fortunately we do have a much more effective vaccine than what you see in flu annually. And so I think it's a good approach that in some ways, if you hear herd immunity, you kind of become almost complacent. And it's truly what you said. You have to keep your eyes on kind of the medical surveillance data feeds about cases, deaths, hospitalizations, and then variants. So I really appreciate that.